Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about the difference between intravenous NAD and intravenous ozone, based on my clinical experience. Both of these therapies are oftentimes talked about for use around optimizing mitochondrial function. If you've listened to any of my videos in the past, you've probably heard me talk about how important mitochondrial function is and how mitochondrial dysfunction, so the underlying deficiencies in the function of the mitochondria really underlie virtually every health ailment you can possibly think of. So really, really important topic. NAD, for folks who are not familiar with it, is an acronym for nicotinamide adenine dinucleotide, which is basically a certain form of vitamin B3. And really, really important for mitochondrial function. And then ozone, on the other hand, has a huge impact on, or kind of a significant clinical impact on a number of different physiological parameters. It's anti-inflammatory, it helps to promote tissue healing, it has antimicrobial effects, it helps to stimulate antioxidant production in the tissues. If it's administered as an injection into joints or it's administered intravenously, it can help to reduce pain in the body, and it helps to improve the oxygenation status of our cells, which is also very important for the mitochondria because ultimately to create energy in our cells, the mitochondria need all these different ingredients, including NAD, but they also need oxygen. And if you ever wonder, like, which one's more important, NAD or oxygen? Well, they're both really important, but you could argue that oxygen is more crucially important because you can go a long time without consuming vitamin B3 and survive, but if you plug your nose and cover your mouth for more than a couple of minutes, you're not going to be around for much longer. So oxygen, super, super, super important. So in terms of the topic of the day here, the topic of the video, so which is better, intravenous NAD or intravenous ozone? Well, there's a couple of ways to answer that question. One way to look at, a couple ways to approach that question. One way would be to say, well, based on the research literature, what has more evidence showing efficacy for outcomes like improving energy or promoting tissue healing or things like that? And to my understanding, intravenous ozone just mops the floor with intravenous NAD from a research literature perspective. Yes, there are conferences all about NAD. There's conferences all about ozone as well, as it turns out. But in terms of the amount of published literature showing the impact of intravenous NAD in terms of human clinical trials, not a whole lot of literature out there, whereas in terms of ozone therapy, tons and tons and tons of literature. And I say that because I teach an ozone therapy certification course, as I have for the past several years. As part of that, I've done exhaustive literature reviews looking into all the research out there, and there's just so much human research data looking at the impact of intravenous ozone therapy. So from that perspective, ozone has a lot more research backing up its use. The other way through which we could answer, lens through which we could look at this question is, like, what's the actual impact on patients when we use these therapies in practice? Because just because something makes a lot of sense on paper, or there's research studies indicating that it should be useful or it is useful, what actually happens with patients? And so from that perspective, in my clinical experience, ozone wins the day again. We've done thousands of ozone treatment, intravenous ozone treatments at my clinic, either ones that I've run myself, or nowadays I have a resident that runs the treatments for me or other colleagues. And in terms of the feedback that I get from patients, ozone is very, very commonly helpful to help reduce symptoms of inflammation, improve energy levels, improve mental clarity, and can really help to resolve a lot of chronic illness issues in a very helpful way, or in a very meaningful way for those patients. Now, nothing's perfect. There's no silver bullets. I've had many patients over the years who have had no clinical benefit from intravenous ozone, unfortunately. But again, that's out of thousands and thousands of treatments. Several hundred patients, if not over 1,000 different patients by now, who have used the ozone therapy. So yes, some no change at all, but more often than not, it's a really helpful adjunct. Now, intravenous NAD. In my experience, and I have not done intravenous NAD with hundreds and hundreds and hundreds of patients. We have not done thousands and thousands of IV NAD treatments, and that's largely because it's really quite rare that we see a significant benefit from intravenous NAD. We run it on patients, when I first heard about it, and hearing colleagues talking about all the potential benefits of it and whatnot, I was excited about it. We started running the treatments, and it was really quite rare that we would see much of a change. It was maybe 10% of the time that we'd see a benefit. And so, we tried it with maybe, 15 patients or so, weren't really seeing, impressive results. So we just kind of let it go to the side, put it on the side burner. Then we, had some referral patients over the course of time where, they were referred to us by other clinicians for the IV NAD. We'd run the treatments, and it was pretty rare that we would see any benefit in them either. And then, every so often we'd have some patients where, just tried everything, just kind of some patients where don't quite want to say a Hail Mary pass, but kind of getting to that point, patients with really late stage like neurological disorders where, we're pretty sure that there was, quite a bit of permanent damage done, but we really didn't want to give up. And so we, tried some different therapies, including the intravenous NAD. Didn't really see much difference in those patients. And granted, in those cases, we were setting the bar pretty high for the NAD. The patients were already, we're they're wheelchair bound and or scooter bound, and we're trying to see if we can get some life into their limbs again, and cases like that really tough. So in that case, NAD, we're kind of hoping for a bit of a miracle there. Did not provide. However, even in other patients where the cases weren't nearly as progressed, the NAD we really weren't seeing a whole lot of positive change there. Now I've had some patients where they said, oh, I was getting IV NAD with my clinician, say I moved here from a different province or a different state or something like that, and it was really helping. I was like, oh, awesome, like let's do it. And indeed, we do the treatment and it would help, but we were doing the treatment alongside other nutrients. So they were getting, say, a Myers cocktail, like, vitamins, minerals, amino acids, and the NAD. They never had NAD just by itself. And so we did a little experiment. We've done experiments with these patients, if they're willing to do it, where it's like, well, why don't we just try the IV nutrients? Because, man, it's a way shorter IV. It's markedly less expensive. And so let's just try that. And lo and behold, whether we had the NAD or not, the nutrients did the trick. And so it's like, it looks like you probably weren't in a really obvious way benefiting from the NAD. It was actually the nutrients that it was combined with. So that's been my experience so far. I want IV NAD to be the best thing ever. I want these therapies to work really, really well, but all that I can do is just relay what I've seen in clinical practice, and based on what I've seen, I can't think of the last time that I specifically recommended to a patient to say, oh, why don't you do IV NAD? Because I think it's really going to make a big difference in terms of how you're going to feel. Whereas in terms of ozone, it's something that I recommend on a really regular basis, given how helpful and effective I've seen it be over the course of time. So with that being said, if you are listening to this video and you've had a fantastic experience with NAD, please post it in the comment section below. I'd love to hear about it. Or if you have tried NAD and it didn't help, but who doesn't love a good confirmation bias? So be curious to know about that too. And if you've had good or bad or neutral experiences with ozone, let me know about that too. I love hearing feedback from other folks, just hearing about their experiences. So I will leave it there. If you are needing some mitochondrial support, perhaps talk to your clinician about some of these intravenous therapy options. And ozone has my vote in this particular battle, so to speak. Just a quick reminder that my upcoming Overcoming Chronic Illness course is coming. The first couple of modules are going to be taught on Saturday, May 28th. Saturday, May 28th. The registration information is available if you're watching this on Instagram in my link tree in my bio, and I'll post the registration link below in the description if you're watching this on YouTube or on Facebook. And if you would like to access my checklist to determine whether or not the course might be applicable to you, I'll have that information in those locations as well. So I hope this is helpful, and we'll leave it there.